If you believe in health is wealth, then you are the right persons to listen to this video. 1 in 4 adults die from hypertension in India, said by Indian Councils for Medical Research. This disease is one of the major risk factors for cardiovascular disease or heart disease and premature deaths worldwide. A report from World Health Organization in 2015 said that hypertension is responsible for 7.5 million deaths and about 12.8% of the total of all deaths globally. You are right, I'm talking about blood pressure. This is equally dangerous like other disease. If you see the chart of disease that kills more people, then you will find cardiovascular disease or heart disease stands at the topmost level. And if you see the major causes of this heart disease, then you will find high blood pressure at the topmost level. So this is how it makes important for us to understand our blood pressure numbers. Now you tell me, what is the last date you checked up your BP? Blood pressure is the pressure of circulating blood against the walls of blood vessels. There are 3 types of blood pressures: high, low, and normal blood pressures. In medical terms, they are called hypertension, hypotension, and normotension respectively. Doctors read blood pressure numbers using tools like a sphygmomanometer, and it is also called blood pressure cuff or BP cuff sometimes. It consists of measuring unit and a cuff. There are 2 groups of numbers in the reader. If you see, it is called a systolic blood pressure number and diastolic blood pressure number. Systole occurs when the heart contracts, pumping blood out, while diastole takes place when the heart relaxes after contractions. Many conscious people possess such tools at their home so they can use it for their health. Problems with high blood pressure is that it causes heart disease. That's the most dangerous things. It also causes heart attacks and strokes, kidney failure, eye problems, chest pain, and other health issues. Causes of high blood pressures can be stress, obesity, excessive alcohol consumptions, increased salt intakes, smoking, diabetes, genetics, aging, etc. High blood pressure is silent killer because it may show no symptoms sometimes, but if you feel moderate or severe symptoms like headache, anxiety, shortness of breath, nosebleeds, palpitations, feeling of pulsations in the neck, dizziness, bloody urine, redness skin, sudden changes in visions or chest pains, or even trouble in speaking, sometimes sudden back pain and numbness or weakness, then don't hesitate to check up your blood pressures. If your blood pressure numbers are between 120/80 to 90/60, then you have no problems of either low or high blood pressures because these categories are considered as normal blood pressures. But if the reader is lower than 90/60, then you have a low blood pressure problem, or higher than 120/80, you certainly have high blood pressures. Now there are 3 stages of high blood pressures. When the reader reaches 130/80, it is stage 1. When it is 140/90, this is stage 2. And if it reach 180 over 120 millimeter, then this is the last stage. It is the emergency crisis. Also, in this stage, third stage, it is the stage of stroke level. You can have a stroke. In this level, it can damage the brain from interruptions of its blood supply, so it's medical emergency. When you're alone at home and hit by high blood pressures, what you can do is take a warm bath or shower, do a breathing exercise or relax. Now these days many of us has stress problems, and this is the key contributor to high blood pressures that scientists says, because when we are in stress, blood produces a surge of hormones, and these hormones temporarily increase blood pressures by causing heart to beat faster and blood vessels to narrow, so this can cause a blockage of blood and oxygen for heart. How can you reduce your high blood pressures? How can you bring down your high blood pressures? You can do by losing your extra pounds or watching your waistlines, exercise regularly, or by eating healthy diets, reduce salt in your diet or sodium. Of course, limiting alcohol, quit smoking, get good night's sleeps, and monitor your blood pressures at home regularly if possible, or get regular checkups in the hospitals or private hospitals. These all are the good methods to counter your high blood pressures. High blood pressures is a common for adults, but kids can also have too. High blood pressures in children may be caused by problems with the kidneys or heart. For the growing number of kids, high blood pressure is due to lifestyle habits like unhealthy diet and lack of exercise. Low blood pressure is equally dangerous that of high blood pressures. Although high blood pressures increase the risk of cardiovascular incidents such as heart attack, as I said before, but it is not linked to higher mortality in frail adults over 75 years. Older people aged 85 and over who had raised blood pressures actually had reduced mortality rates compared to those with lower blood pressures, regardless of whether they were frail or not. So, low blood pressure is rare but very dangerous. You can understand your low blood pressures either from reading machines or from symptoms. Some of the symptoms of low blood pressures are blurred or fading visions, dizziness or lightheadedness, fainting, fatigue, trouble concentrating, and nausea. In extreme low blood pressures, you can have confusions, especially in older people, cold, clammy skin, decrease in skin's colorations or pallor, rapid and shallow breathing, weak and rapid pulse, and unsteadiness. Your low blood pressures may be caused by infections in the bloodstream or diabetes, thyroid, blood loss during injury, or weaknesses due to dehydrations and pregnancy. Do not sit or stand rapidly, meaning be careful when rising from lying down or sitting. Avoid long standing or prolonged exposure to hot water. Avoid heavy lifting when you have a low blood pressures. To immediately cure your low blood pressures, you need to drink more water, eat salty foods. You can drink coffee and caffeinated tea or any non-alcoholic fluids. But you have to drink more during hot weather and while sick with a viral illness such as a cold or the flu. Elevate a little higher your head when sleeping at night. and do regular exercise, of course, regular checkups as well. Actually, checking up your blood pressure is one of the 4 vital signs that can help to give a general idea of a person's overall health. Right, there are 4 vital signs. It includes blood pressures, heart rate, breathing rate, and body temperatures. So my humble request you is whenever you go to the market, don't forget to visit to the hospital or private clinic to check up your blood pressures. Thank you.